Hi, are you John Doe?
Yes.
All right, my name's Jessica Killerlane. I'm a PA student here at the University of the Cumberlands, and today we're going to be doing your mail exam. So can I just have you confirm your name and date of birth for me?
Joe Doe, May 16th, 1994.
Okay, and I'm just going to check that medical record number. Okay, perfect. Please excuse me while I go wash my hands. Okay, and like I said, today we're here for a mail exam.
Yes.
So the first thing I'm going to do is I'm going to make sure I explain each step before we go through this. And then I'm going to drape your chest and your abdomen. And I'm going to make sure that I'm always wearing gloves. And I'm going to have you standing while I sit. My hands are still wet. So the first thing I'm going to do is I'm going to just inspect the skin around the penis and scrotum, and I'm looking for nits and lice at the base of the pubic hair. And then I'm going to go ahead and have the patient retract their prepuce and replace it, or I'm going to retract and replace the prepuce, and I'm looking for any chancres or carcinomas. And then I'm going to go ahead and just look for any scars, nodules, inflammation, ulcers of the glands and the meatus. And then I'm also going to locate the position of the meatus. And now I'm going to go ahead and palpate the glands in the urethra meatus between my thumb and my first finger, and I'm palpating it to open to see the inside of the meatus. The next thing I would do is I would palpate the shaft between my thumb and my two fingers, and I'm looking for any tenderness, inflammation, or induration. And I would omit this in a asymptomatic or young patient. Then I'm going to go on and move to looking at the scrotum. So I'm going to inspect it first. So I'm going to lift up the posterior side and look to see if there's any swelling, masses, lumps, or veins. And that looks good. And the next thing I would do is check the contour of the scrotum. And if it was underdeveloped, there could be cryptorchism. And if there was swelling, it could be an indirect inguinal hernia or a hydrocele. So the next thing I'm going to do is I'm going to palpate the scrotum. So I'm going to palpate the epididymis at the top of the testes, and it's going to be posterior superior, and it's going to be cord-like and nodular. And then I'm going to go ahead and I'm going to palpate the testes and the epididymis in between my index finger and my thumb. And I'm looking for size, shape, consistency, nodules, and inflammation. Then I'm going to go ahead and palpate the spermatic fluid and the vas deferens, and I'm going to start at the epididymis, and I'm going to palpate up into the superficial inguinal ring. And then if I did find some swelling, I could do the transillumination test. So I would darken the room, I would take a light, I would stick it behind the mass, and if there's swelling, it would be this like red glow. But tissues and blood do not transilluminate, so it would have to be swelling. So then I'm going to go ahead and move on to the hernia exam. So once again, I'm sitting, the patient is standing. So I'm going to use my right hand for the right side, and I'm going to put my finger at the inferior margin of the scrotum, and I'm going to feel for, this is for the right inguinal hernia, so I'm going to go ahead and push my finger up towards the inguinal canal, and I'm vaginating the scrotum, and once I'm up there, I'm trying to find the inguinal ring, which is lateral and superior to the pubic tubercle, and I would have the patient bear down or cough, and what I'm looking for is any bulge or mass sliding down in that inguinal canal. And then I would do the left side with the left finger. So the next thing I'm going to look at is the femoral hernia. So I'm going to put my two fingers on the anterior thigh in the femoral canal, and I'm going to go ahead and have the patient bear down, valsalva or cough, and I'm looking for any swelling or tenderness. And then I'm just going to note that the femoral canal is inferior to the inguinal ligament, lateral, and these kind of hernias never terminate in the scrotum. So that's it for the hernia. So I'm going to move on to the rectal and prostate exam. So I'm going to have the patient go ahead and lay over the table. with his chest across. You can have them propped up, leaning on their elbows. And the first thing I'm going to do is I'm just going to check the sacrococcygeal and perianal area. And what I'm looking for is just any nodules, masses, lumps, lesions, excoriations, really any abnormalities. And then I'm going to go ahead and have the patient bear down, and I'm looking at that anal area, the anus, for any lesions. And now I'm going to move on to the actual exam. So I'm going to lubricate my finger, and I'm going to go ahead and have the patient bear down, and I'm going to insert my finger towards the umbilicus, checking sphincter tone as I'm inserting, and then I'm going to make sure my finger is inserted all of the way. And then I'm going to go ahead and palpate the posterior prostate, and feel the lateral lobes and the median sulcus. And then I'm noting any tenderness, swelling, nodules, masses, just anything that feels abnormal. And then I'm going to do a rectal sweep. So I'm going to go clockwise and counterclockwise, and I'm trying to feel all of the rectum as much as possible. And I'm looking for any nodules, masses, swelling, inflammation, tenderness. And if I feel any lesions, I'll tell the patient to go ahead and bear down to bring that lesion closer to my finger. And so now I'm just going to remove my finger from the anus. I'm going to, if there's any fecal matter on my finger, I'm going to note the color and then put it on a fecal occult test and send it off. And then I'm going to make sure to give them a napkin to wipe their anus. Do you have any questions?
No.
Perfect. Well, if you have any questions, call the office. Thank you.